Heather begins getting her slides ready, I'm gonna reintroduce myself. I am Sean Mannion. I am the Chief Scientific Officer here at ConsenSys Health, and this is the Veterans Summit, the Veterans Health Summit 2 that we are co-hosting with Dixon Center for Military and Veteran Services. Earlier today, we heard from the founder of Dixon Center, Colonel David Sutherland, giving some opening remarks, and then we just heard a wonderful panel headed by Colonel Sam Whitehurst of the Dixon Center with 5 providers and some of them veterans and some of them spouses of veterans, looking at veterans' health issues. And now we're gonna transition to a different look of taking some of the emerging technology that's available and how it can be focused on those problems, and some of the preliminary work that we've been doing with Dixon Center to do just that. And with that, I would like to introduce ConsenSys Health founder and CEO Heather Flannery, not just my boss and colleague, but a friend of mine who has, since before the inception of ConsenSys Health, really focused on veterans issues. And one of our primary projects from the get-go was exactly that. And when she put it in front of me of January of 2020, it immediately reminded me of those elements of Colonel Sutherland's white paper on the Sea of Goodwill, and how you take this distributed will to do good for, in this case, the veteran community, and yet align that goodwill, those good actions, into something that matches the resource to need. And as soon as I saw her looking at the technical side of that same problem and the solution for that same problem, I said we need to meet. And so at the beginning of ConsenSys Health's inception on March 2nd, 2020, we sat down with Colonel Whitehurst and Colonel Sutherland and sort of outlined for them what some of these technologies could do. And from that was sort of born a new effort that we are getting ready to roll out much faster in the days and months ahead. So with that, Heather, please take it away.
I'll begin with my introduction while that's going on. My name is Heather Flannery. I'm the founder and chief executive officer at ConsenSys Health, and it is my profound honor to have partnered with the Dixon Center and to follow our esteemed speakers today is really a humbling experience indeed. I am incredibly excited to share with you an initiative that ConsenSys Health and the Dixon Center have been collaborating on for some time. And I hope that it leaves you inspired and ready to engage with us in our shared mission. This talk is about an initiative called VICI, and yes, it comes from Veni Vidi Vici. That is Veterans and Vulnerable Populations, Incentivized Coordination and Integration. VICI is a breakthrough model for increasing veteran access to privacy and dignity-preserving medical, emotional, and economic support. You'll notice both privacy and dignity are themes that ConsenSys Health and our partners at the Dixon Center value deeply, and we have some very unique opportunities to move forward in these areas. Next slide. So the first idea that I'd like to come up several orders of abstraction in how we're looking at the problem space and introduce an additional separate perspective about the macro pace of technological change. Throughout human history, our rate of technological advancement has driven our society at large, certainly including warfare. And in the past 50 years, approximately, we've had a massive explosion in the rate of technological change. In the last 5 to 10 years, that rate of technological change has continued to increase. And in very recent times, even in the last 2 to 3 years, we've seen extraordinary further acceleration of technological change. This is a wonderful thing, but the rate of change or adaptation of human systems and bureaucracies has not changed in any meaningful way, which means that our policy environment, our institutions, even our mental models, as we consider the art of the possible, are in fact now simply not yet aware of what is newly possible. Further, we have a tendency to radically underestimate both the risks and the opportunities that are created by radical technological advancement. And today, in September 2021, as we sit here, at this event, we have available to us extremely powerful, very new technologies that enable capabilities that sound like science fiction, but they're not. Next slide, please. So what if it were newly possible, only recently possible, for us to integrate, optimize, and automate processes that spanned many organizations, governmental, philanthropic, the private sector, and do so in a way that individualizes instead of homogenizes multi-sector support for veterans and their families? I will argue that we are in fact now living within this technological possibility that in the very recent past would have been completely logistically impossible and untenable. We now have this opportunity before us. What if it were newly possible for veterans and their families to be empowered by the ongoing analytical use of their aggregated, validated, and comprehensive health information and health relevant information, but without any compromise to their privacy? Our entire worldview involves data exchange, data centralization as a first principle for activating all kinds of resources and possibilities. But today, we no longer have to make the trade between privacy and security, between privacy and being activated into programs and resources. What if it were newly possible to match and integrate a unique set of veteran support services for each veteran across an ever-growing number of programs, such as those that the Dixon Center so ably leads and coordinates? What if new systems of multi-stakeholder incentives could much better activate the sea of goodwill that we have in the United States of America and globally? These are the questions that to which the VICI initiative is the answer. And ConsenSys Health and the Dixon Center and our other partners and allies have been hard at work for some time determining how it is that we can bring to bear these new technologies and these new possibilities as rapidly as possible for the benefit of veterans and their families and other vulnerable populations. Next slide, please. So why is now the time that VICI could succeed? Earlier, I mentioned that the rate of change of human institutions and cultures is not nearly as rapid as the rate of change of new technologies. Also, we tend to normalize and surrender to some of our most chronic systemic challenges in the healthcare industry. In the face of impossibility, we draw back our expectations in the interest of realism. Well, now we have not only the capabilities, but we believe our hypothesis is that we are at an inflection point where the timing culturally is paired with the readiness technologically. Our COVID-19 crisis has exposed serious flaws in the current health system, but all of us here gathered today, all of our esteemed speakers are deeply, deeply familiar with these long-standing systemic flaws in our health system. What has happened, a silver lining in the tragedy of the COVID-19 pandemic, is that the general public has become aware in a way that they were not before about the problem of data silos in healthcare and the way that it affects our ability to do things that seemed like they should be so straightforward and intuitive, like testing, like vaccination, and so on. This is paired with the technology readiness of a new generation of paradigm shifting technologies. I know this is not a technical audience, so the details of these technologies is not the key takeaway of what I'm hoping to convey to you. But what I would like to convey is that the order of magnitude and significance of these next technologies are on the order of the Gutenberg printing press, the integrated circuit. These technological innovations are massive and paradigm shifting in their impact, and they have reached a level of maturity and readiness that coincides with a cultural tipping point and a macroscopic readiness for change. One of the core technologies that is at the heart of this is called blockchain. Many of you may have heard of the blockchain. You may have never heard of blockchain. You've almost certainly heard of Bitcoin. And Bitcoin is the underlying, blockchain is the underlying technological innovation that is a new infrastructure for trust. And it also has an application of currencies, which enabled Bitcoin as the first example of that. But the underlying technology is far more fundamental to the transformation of human societies, we hope in a positive direction, than the cryptocurrency first application of it that you may have become familiar with. We're not going to go into a deep dive explainer on blockchain technology, but critically, it is a technology that facilitates automation and orchestration across organizational boundaries, across entities, up and down a value chain, throughout an ecosystem. It also is a technology that can facilitate radical individualization. In healthcare and life sciences, that means taking precision medicine to its culmination point. It means implementing a learning health system in a way that realizes the vision and intent of that movement, and ultimately takes individualization far beyond just our biomarkers and our biological physical bodies into the totality of our social determinants, our community, our lived experiences, and the other aspects of our life that have been so richly described throughout the day. Next slide, please. So just defining what, back one, please. Defining what blockchain is, just at a fundamental level, it is a distributed ledger, which is really a kind of database. It records transactions in a way that is immutable, that is tamper resistant, and that enables parties that do not trust one another, who have even potentially adversarial relationships or competing interests. For example, I'm concerned about the privacy of my data, and I may have a medical condition like clinical depression that I don't want everyone to know about, but I still need to access care. Blockchain is an unusual technology in that it facilitates both the ability of a guarantee of identity, and it facilitates the ability of a guarantee of anonymity. It's really a counterintuitive thing to imagine a technology equally well suited to achieve both things, and to enable an individual to disclose or not disclose in granular ways information about themselves, and to control digital assets and data in a very granular way about themselves. Next slide, please. So in healthcare and the life sciences, the use of blockchain is actually quite a bit further along than is generally understood. When people hear about this technology, there is a lack of understanding that the technology itself is long since validated. Now, whether the use of the technology in healthcare or life sciences moves population health endpoints that we all care about, that's not yet validated. But at a technological level, we're no longer in the phase where what we need to do is validate whether this technology works. We know it does. One of the surprising things is to see how widely across our industry major blockchain initiatives have gotten underway, and gotten underway years ago at this point. So when we're sitting here in 2021, this actually isn't new at all, and these organizations and more, most governments around the world, including our own in the United States of America, pharmaceutical companies, payers, providers, many parties have been heavily invested in and recognized the value, the potential value of blockchain technologies, years ago at this point. And in ConsenSys Health's partnership with the Dixon Center and what we're seeking to do with the VICI initiative, we are creating another such consortia like you see here that will bring about in our vision, in our hope, a completely next generation approach to how we tackle some of our stickiest problems. Next slide, please. So when we think about blockchain, there are multiple blockchain technologies. Just so that you understand who ConsenSys Health is, we really come out of what's called the Ethereum ecosystem. Ethereum is an absolutely revolutionary global innovation. It has no owners and no jurisdiction, and it could be thought of as the beginning of the new internet. It is not owned by anyone. It is a neutral public resource. And the origin of blockchain as a technology began with the first Bitcoin that was ever mined in 2009, and Ethereum is the next generation of blockchain that was introduced to the world in 2014. The term Ethereum carries 3 distinct meanings. You can fill out the animation on this slide, but don't move to the next slide. So Ethereum is a protocol that is completely open source, free to the world to use. Keep going, please. It is also a network. There is the Ethereum mainnet that is a living, distributed, what's called the world computer, that is available for all of humanity to use and to connect to and to benefit from. And it is lastly a cryptocurrency like Bitcoin that is the native crypto asset to this protocol called ETH or Ether or Ethereum. Go ahead. The Mr. Joseph Lubin on the right is the founder of the organization called ConsenSys. ConsenSys Health is a spin-off of ConsenSys seeking to bring this technology with some others into the healthcare and life sciences space to drive what we believe will be great good for humanity. Let's move to the next slide. Our perspective is that for healthcare and life sciences, blockchain is incredibly important. It's absolutely necessary, but it is not sufficient. So there are 2 other families of technologies that ConsenSys Health is integrating into blockchain that underscore or underpin what the VICI initiative can do and will do for veterans and their families. Those are, on the left-hand side, you see a royal blue set of boxes. Those are all the aspects of blockchain. The networks themselves, something called smart contracts, which is an automation technology, tokenized assets, which is an optional way of using the technology, and then finally applications that run within blockchain networks. That's all what exists when we say blockchain. But in healthcare and life sciences, we have 5 areas of major challenges that are extremely unique to our industry. And those are cybersecurity, compliance, identity, bioethics, and privacy. And the combination of blockchain technology with the 2 other buckets that underpin VICI is what we believe will make these things possible. And it's really in the convergence of these things that these radical new possibilities are created. Privacy in depth represents a bucket of brand new technologies that all have to do with either hardware dependent or software dependent advanced privacy preservation methods. The key idea to take away there is think empowerment of the individual and think granularity about the allowed use of data. Also, moving away from the notion that data has to be exchanged in order to be used. It can be analytically activated without being moved from its point of origin. That, in and of itself, is a radical enabler and empowerment of individuals that through the VICI initiative we can create. Decentralized artificial intelligence is the 3rd emerging family of technologies. And when we think about sovereignty and self-sovereignty and agency and dignity and what it means to live in a massively technological society, well, our data is our labor, our data is our identity, Our data is our human potential to have our diseases cured and our suffering addressed. Our data is significant in a way that we have failed to elevate to the appropriate level because it has existed in silos. And if our data is spread in this wide diaspora of institutions everywhere, we cannot actually create value from it. So even though it belongs to us in some legal framework, changing jurisdiction by jurisdiction, we can't create value from it. Well, governments and corporations can use artificial intelligence to achieve their aims, but individuals cannot. Those resources are completely outside the reach of individuals. But our vision is that ultimately artificial intelligences will also become self-sovereign. And we want to see veterans and vulnerable populations be the first that receive access to this incredibly empowering new technology instead of segments of the population that are overlooked or deprioritized. Next slide, please. So you hear about data constantly, you think about data constantly. We'd like to offer a new semantic structure for talking about data because it ceases to become meaningful in discourse in the way that we use it today. We talk about source data as at its point of origin, as it's being created. You could think of us going through our lives and leaving a continuous trail of data everywhere we go, from social media to our healthcare interactions to our banking and financial relationships. Everything we do in this massively technological society generally leaves some kind of data trail that exists institutionally and individually in massive and exponentially increasing scale. Metadata is all the information about that information. It's what we need to know to be able to even understand what kinds of questions we could answer with that data. And then finally, the derived data is the actual value that we're after. It's an analytical result or finding that is the point, the reason why we would want access to source data in the first place, as described by its metadata. In this framework, we will be tackling self-sovereign veteran health and health relevant information as source data, abstracting metadata, and creating extremely high value derived data for the veteran, by the veteran, under the veteran's control. This message of empowerment and dignity and agency and sovereignty is incredibly important to the VICI initiative. Presently, in the way the world works right now, if you want to create value out of data, you have to first exchange it somewhere and centralize it. We believe that we've reached the logical extreme of that approach, and now through the use of these new technologies, we can use radical data decentralization to create value on behalf of individuals without that data having to be shared or exchanged in order to be used. Next slide, please. So just spending a quick moment here, we live today with respect to the way that veteran and their families' health and health relevant information is generated, used, governed, custodied in what we believe to be a sunsetting paradigm. We are in the last final chapters of a dysfunctional technological paradigm that created a lot of value and also left many, many things far behind that were important to us as a civilization. That sunsetting paradigm always meant that we had to copy infinitely and move data everywhere in order to create value from it. ConsenSys Health, with our partners like the Dixon Center, through initiatives like VICI, we are helping to drive the emerging paradigm where we are able to create value from information without having first moved it or centralized it, while preserving the privacy, the dignity, assuring the identity, verifying the compliance, and securing from a cybersecurity perspective the infrastructures and the data that move through these new systems. We have, next slide, we have reached the logistic extreme of data centralization strategies, and just a quick point I want to make is that every human being in this massively technological society is going to create over 1,100 terabytes of data about themselves that all can be used analytically to benefit the individual. if the individual can be empowered to use that. And that is what the VICI initiative it purports to do and will intend to do for veterans and vulnerable people. Let's move to the next slide. So you can go ahead and build this slide out. So right now, our health information is siloed. Trying to inspire institutions, corporations, please send us your data. Your data here, because I'm one of 10,000 ever-growing organizations that wish to centralize it so that I can provide some kind of analytical value. That's the heart of it. Well, our proposition is that instead of going, instead of just making bigger silos with blockchain networks, we have to connect those networks so that we're finally killing the data silo, not just making bigger ones. The way to accomplish that comes back to what I was telling you earlier about the neutral, open, public resource that is the Ethereum mainnet as the mechanism by which private blockchain networks can all be made to bridge and interoperate with one another. This is how these smaller blockchain networks can create value without making bigger and bigger and bigger data silos. Next slide, please. So this is the last slide in my presentation, and it's an eye chart. So wanted to ask your forgiveness in advance. But this is a conceptual overview. Now that you have the broad framing of what VICI is, why we're doing it, this is a conceptual overview of the scope of what this new infrastructure, this new model that we are creating can deliver to veterans and their families. There are the foundation of all of it is the concept of enterprise blockchain blended with advanced privacy preservation and decentralized artificial intelligence that's delivered through ConsenSys Health's core innovation, which is the elevated compute platform, and the use of the neutral public resource, the Ethereum mainnet. This delivers the ability to apply in real time and optimize intentional bioethical principles to the use of to how this new technology affects veterans and their families. It creates the ability to provide cryptographically verifiable guarantees of privacy, and to make that privacy highly granular, time-bound, this specific data for this purpose, for this period of time, etc. And to make that data sovereign to the data subject, the veteran and their families in this case. The underlying infrastructure here has a radically enhanced cybersecurity posture by comparison to baseline infrastructures as they exist today. This is at a fundamental level. I also am acknowledging that these new classes of infrastructure introduces new classes of cybersecurity risk, and mitigating those and controlling for cybersecurity is massively important. We view new infrastructures, new utilities like VICI as critical infrastructure, next generation critical infrastructure, and it needs to be secured and defended as such. This technology facilitates the creation of decentralized identities, which can include identities of institutions, of objects, of medical devices, of automobiles, of anything that you can imagine. But importantly, it can include identities of human beings, and those human beings can take control of their identity in what's called a self-sovereign identity. And this ability to control that identity, how it is connected to pieces of data and engagement in processes is fundamental to the ability to achieve VICI's vision. And then lastly, healthcare compliance, as you all know, is certainly substantially more complex with veterans and their families and military. It's already massively complex for the general population. We need to be able to programmatically design compliant processes and provide proof of same without massive bureaucratic burden in order to achieve compliance. So much like we feel that our next generation of technology is intrinsically superior from a cybersecurity perspective, so too does it facilitate a less burdensome achievement of compliance and move past just to the letter of the law compliance into the spirit of the law with the achievement of bioethically intentional and privacy preserving modalities. So that's at the foundation of VICI. There's both a user experience and a technological design. We're not here to get into the weeds about the technology, but rather to focus on the art of the possible that VICI can achieve. There will be, for the veteran, starting over in the yellow box, self-sovereign data lakes that have intelligent automation that is targeted for and by that individual intrinsic to it. So this means that veterans will have a place that is secure and trusted where they can aggregate big data about themselves. This is a data lake where n equals 1, where the data subject is able to aggregate, curate, and ultimately monetize for value if appropriate, all of the data about themselves that is generated in n number of institutions. And this is facilitated in the United States by the enforcement window coming into effect for the 21st Century Cures Act. So out in community care, outside of the VA and outside of military medicine, every citizen of the United States now has a right under the 21st Century Cures Act to receive their health information. Now, the infrastructures to facilitate this, what a person is supposed to do with this information, where they're supposed to put it when they receive it, and critically, how it is supposed to be aggregated and curated, those are unsolved problems that we feel VICI will absolutely solve for veterans and their families. But we are already in a regulatory and a policy environment that supports self-sovereignty and is trying to finally cure the data silo problems that we've had since the digitization of medicine and the implementation of meaningful use and EHRs and how that went down in the United States. The ability over on the far right, tokenization and funding functionality, this allows us to bring all of fintech and finance and payments into the simplification of things like claims, where multiple payers perhaps have accountability across different episodes of care or different disease states or conditions or circumstances. This allows us to facilitate the pooling and aggregation of resources that might come from multiple sectors into a unique veteran-specific assemblage of resources from within the sea of goodwill. The ability to provide financial resources across multiple modalities and connect to non-financial critical resources like emotional support, like healthcare delivery, like transportation, etc. These things are facilitated by the transactional economics enabled by blockchain. And then finally, from a user experience perspective, veterans and their families will have the ability to make empowered choices by seeing how the different resources that they might want to access are sourced and priced. They will be able to have self-sovereign software that assists them with the coordination across many and perhaps an increasing number of programs, using their data and their information to affect their will and manifest their well-being and prosperity. It does not change the fact that all of the institutions that originate that data, they too own their copy that they originate, that they must govern, and then they custody. But the individual now, the individual veteran and their family, under the law and given the new technologies and infrastructures created by VICI, can be radically empowered in a way that no individual institution ever could on behalf of a given veteran. So I'm gonna stop there. I believe there's one last slide just as closing remarks. So I wanted to emphasize something that I heard Colonel Sutherland talk about multiple times. When you've met one veteran, you've met one veteran. For me personally, I've met veterans that were each of my grandfathers, multiple uncles, my brother-in-law, many dear friends, and everyone is unique and everyone served. And I cannot thank all veterans enough for their service to the United States. And this opportunity to work with the Dixon Center to bring the most radical emerging technologies to this most deserving population in a way that supports uniqueness and individualization instead of homogenization is such a rewarding endeavor to me, and such an honor on behalf of everyone at ConsenSys Health to be engaged in this mission.